Hello and welcome to Common Ground, an inside look at Suffolk County. I'm your host, Suffolk County Sheriff Steve Tompkins. Now today, we have two extraordinary guests, but we're going to begin with an executive in healthcare in the city that is doing some outrageously good things for the largest, dare I say, community health center in the city of Boston, and that would be Myechia Minter Jordan, who is the president and CEO of Dimock Center. Now, I paused there because I used to work there ages ago, and it was Dimock Community Health Center, but now it's Dimock Center. That said, extraordinary things go on there, and it's what you would kind of call a one-stop center for healthcare. And we'll explain that, we'll talk about that, all of the things that they have going on at Dimock. But if you don't know Dimock, and if you lived in the city for any time more than like a week or so, I'm sure you've heard of it, if not have been there. But if you haven't, you really should get there. So without any further ado, Myechia, thank you so much for coming on.
Thank you for having me.
Really appreciate it.
Thank you.
So talk to us about, first of all, your catchment area. You're in, is that considered Dorchester or Roxbury, or is it on the line?
We're in Roxbury, and our catchment area is Roxbury, Dorchester, Mattapan, JP. And that is primarily as it pertains to our health center. For our child and family services, as well as for our behavioral health services, our reach is far greater. In the behavioral health program, for example, we see over 212 zip codes represented in our client base that has the services under our behavioral health umbrella. So our reach is very, very broad, and we serve the entire Commonwealth, particularly in our behavioral health program.
So I referenced it's almost like a one-stop center for healthcare. Now you just cited three different components. Take each one and explain a little bit to our audience what each one does.
Sure. So as a federally qualified health center, we provide primary health services within our health center building, and we're blessed to have a 9-acre campus in Roxbury. So 9 acres, 9 buildings that deliver primary health care services, some specialty services. In our health center alone, we have over 14,000 visits a year. As it pertains to, over 14,000 patients and over 40,000 visits, much larger. As it pertains to our child and family programs, we have Head Start, Early Head Start, preschool, and early intervention.
Right on the campus?
Right on the campus, as well as an adult GED program. In that program, we have 400 beautiful kids on our campus every day, and over 200 individuals graduate from our GED program each year.
Is this year-round, or is this just during the school year?
Year-round.
Okay.
Year-round. And then in terms of our behavioral health program, that's really what distinguishes us from other health centers. In addition to the child and family services, we have a 35-bed inpatient detox unit, 4 halfway houses on our campus. We also have outpatient mental health, outpatient substance abuse, and a shelter on our campus that houses 26 families. We also own residences throughout the city. We have a very unique program for adults with disabilities, and we run the homes for those. We also have a unique program in terms of women who are infected with HIV and have substance abuse and mental health issues, and we run a home for these women as well. So we are more of a human services agency is the way that I like to think about us. Thus the name change to the Dimock Center, because we are more than what one would expect in a typical community health center. And we are the second largest in Boston, behind East Boston, and we serve over 17,000 clients a year with over 70,000 visits, almost 80,000 visits a year.
Now, with all of that, how big is your workforce? How many people do you have?
We have about 400 employees. We're the largest employer in Roxbury. So there's a responsibility to the community in terms of the services we provide, as well as a responsibility to the community as an employer, and we balance both.
Now, you said you have a shelter?
We do.
Talk to me about the shelter, and specifically, is it a shelter where you take the entire family unit? Because I know some shelters won't allow the young boys or the men to be there. It's just women and girls.
I'm so glad you brought that. We're one of the few shelters that does allow the male head of household to reside with the family. And so the shelter is one of the most beautiful places on our campus. It's just a warm, loving space, and it's a place where you don't feel as if you're homeless when you're there. You feel as if that is your home. And then the beauty of having the shelter on the campus is that the clients also have access to our health services, all of the programs there, as well as our GED program, the mental health services. So any access point that you come in onto our campus, and whether or not it's through the health center, through our shelter, you have access to all the other programs and services there.
Two-part question. How do you get clients, or how do clients are referred to the shelter, and how long can they stay?
So our shelter is a closed system. We work with DTA, Department of Transitional Assistance, to refer clients to us. They typically stay with us anywhere anywhere from 3 to 6 months, and we work with them to find permanent
Oh, sure you
housing.
do. Okay.
Yes.
All right.
The other areas of the campus, whether or not it's the health center or our behavioral health programs, we will take anyone and everyone regardless of their ability to pay. So we are open to the community no matter what your insurance level is. As part of our federal funding, we are committed to provide services at low or no cost. And we also have a pharmacy on campus that also we are able to give medications to our patients whether or not they're able to afford them for those critical medications for them. So we're really excited to be able to do that as well.
And what are your operating hours? When are you open?
We're open 7 days a week. Our 24-hour programs, the halfway houses, the detox unit, 7 days a week, 24 hours.
Nice.
The health center is open 7 days a week, primarily on Sundays. We have pediatrics open. All the other clinics
no
open
kidding.
on
Okay.
Saturday,
Right.
in addition to pediatrics.
So you're open on Saturday and Sunday? Okay.
And Saturday and
Right.
Sunday. And then we have evening hours, Monday through Thursday, evening hours. So we really try to make sure that we're there for the community when they need us. When I started off as Chief Medical Officer now almost 8 years ago, one of the things that I did was make sure that we expanded the evening hours because we really wanted to be respectful of those who can't take time out of work, and also the weekend hours so that people have access and they can still work and still take their kids to school. So we made a concerted effort to make sure we have as much access as possible.
Now, do you have dental and eye care also?
We have dental, we have eye care, we have a wonderful optical shop, we have the best glasses in town. I wear glasses myself on some days, so I take advantage of that.
Talk about a plug.
Yeah,
Huh?
I'm telling you, we have, from Mass Health glasses, the full gamut, all the way up to Prada. So we are really fortunate to have our optical shop connected to our eye clinic so that when individuals leave, they can get their glasses. We actually can do the lenses there within the clinic. We also have a full-service dental clinic that also serves adults and children. We have HIV services within the health center, OBGYN, pediatrics, adult medicine, primarily staffed by internal medicine physicians. So we have pretty much everything, podiatry as well as orthopedics. So we have some specialty services there too.
And are you affiliated with one of the bigger hospitals in the city?
Yeah, so our primary affiliation is Beth Israel Deaconess. We have a secondary affiliation with Boston Medical Center. Most of the providers in the adult medicine clinic are on staff at Harvard. We have a number of Harvard students, residents that work with us. So we are very closely linked with our academic partners. Also have an affiliation with Children's Hospital and our pediatric clinic. But we want to make sure that not only are we creating a pipeline for students to come in and then hopefully begin to work for us, but also making sure that we always are teaching. We have our history as teachers, being when we were the New England Hospital for Women and Children, having had the first nurse in the country work there, Linda Richards, and graduating the first African-American nurse, Mary Eliza Mahoney.
And it goes back, how old is it?
1862. Our campus dates back to, so it's a beautiful historic campus, and when you walk through the buildings, you get that flavor of the history. Everything in Boston is old, I like to say, but we have the benefit of having had really strong female leaders who began the hospital, and then when we transitioned to a health center in 1969, we retained that love of learning and the love of teaching throughout all of the areas within the health center.
So that's interesting. 1862, I believe Roxbury was considered the countryside
Yeah.
back in 1862. Seriously, you know?
Yeah.
You know, you had to take the whole horse and buggy thing all the way out. Talk to us about the state of healthcare in the Commonwealth, and then let's talk about it nationally. But what's the state of healthcare now? Are we in a good space or are we in a challenging space?
I think we're leaders in healthcare in the Commonwealth. As you know, we all know that we were the leaders in healthcare reform. We have done a lot of work in ensuring that the majority of individuals have access to healthcare. We're very fortunate to have a rich network of community health centers that provide many different access points for community members to engage in care. And we really try to do a lot of work, particularly community health centers, of being very efficient in the way that we deliver services, but also at the same time very high quality. So when we see this push towards patient-centered medical homes, that's sort of the new jargon of this time now. Health centers have been doing that kind of work of being very comprehensive, having all the services delivered in one place, surrounding the patient or client, and really moving the needle on some of the healthcare outcomes that we see. When I look at Dimock and our quality measures, we surpass not only local but also national measures. So we have done a lot of work to make sure that health centers, and our health center in particular, is at the forefront of healthcare delivery. really already understanding that you have to integrate behavioral health into primary care in order to fully address a patient or client's needs. So we've done a lot of that work, and Massachusetts as a whole has embraced the healthcare movement. We're now trying to refine some of those efforts, trying to find more ways to be cost efficient. But I think we're a leader in that regard. It doesn't mean that we have that we have all the solutions.
Sure.
Healthcare costs are still, exploding and really need to be curtailed. But I think health centers really represent a great way to do that while still delivering high quality care.
So, it's interesting, in my world, in public safety, there's a big discussion ongoing about substance abuse and mental health and opiates and the scourge of opiates and the like. And I know you have a behavioral health center there. Talk to us about the need for legislators and others to understand just, one, how wildly out of control this will get. I mean, it's already out of control, but how wildly out of control this will get if the necessary resources aren't brought to bear to address substance abuse and mental health.
Yeah, I think having had the opportunity to participate in discussions both at the state and the local level, I feel fairly confident that Governor Baker as well as Mayor Walsh, they understand it. And Mayor Walsh, as we all know, really understands it from a personal perspective. I think where we still need to make some movement is in terms of making sure that everyone is on board in terms of how do we provide access to these services, how do we prevent them, first of all, right? So we need to go back to, the school systems and making sure that we are addressing these things at an earlier age. We need to address the family unit and the mother and father who may be addicted, providing services to them so that those same things don't get passed on to their children. So stopping that cycle of abuse that often happens, as well as dedicating more resources to areas that have a full scope of treatment. You can put money into a detox, which we should and we do, but we also need more resources there. But if individuals don't have the next step after that, what do they do?
That continuum of care.
You have to have the next step laid out. You have to have access to a halfway house. You have to have access to outpatient services. And one of the ways in which Dimock distinguishes, we are distinguished from others, is that we have that full gamut. We have the detox, 4 halfway houses, outpatient mental health, as well as outpatient substance abuse. And you really need that full continuum to reduce rates of recidivism and to reduce all of the different impacts that we see of drug abuse on families. And we have to get rid of some of the stigma. We have to be able to talk about it. Because there are so few families that I've encountered that don't either have a mental health issue or a substance abuse issue, and we hide it. And now is the time to talk about it, because when you don't talk about it, people are isolated, and that's when bad things happen.
So do you find that people are a little more open to talking about it than, say, 5 or 10 years ago?
I think so, and I would like to give Mayor Walsh a lot of credit for just really stepping up and saying, this is my struggle, this was my struggle, this is who I am, and really taking some of that stigma away. There's more work to be done, and I know his administration is working on that, but I think there's still more room, particularly in our community, in the African American, the Black and Brown community, to really begin to have deeper discussions around this. No different from the HIV epidemic and AIDS epidemic, where we didn't talk about it. We hide mental health. We are embarrassed by it, and there's such a strong linkage between mental health as well as substance abuse. Most of the people in our detox are dually diagnosed. They have both, and one can often lead to the other. So really being able to have broader discussions around it, and I see Dimock as a convener in that regard. That's what we want to be. We want to bring people together, have the discussion, and really talk about how our model can really help to make a difference.
Interestingly enough, 85% of the population at my facility, which is a county facility, which means when your sentence is 2.5 years or less, you go to a county facility. On average, men are there between 12 and 14 months. Women are there between 6 and 8 months. 85% of my population is there because of some involvement with drugs or alcohol. 42% present with some form of mental illness, from the most passive to the most aggressive. And in our female population, 36% of our female population is dually diagnosed, and so it's something that we deal with it, one, because we have to, but that's not what we're built to do, and so when we talk about that continuum of care, I agree with you. People need to have a place to go once they get that first step in that ladder of care. It really is a continuation. They can go on for years, frankly, and getting people to understand that and getting legislators to allocate the money for that is something that we try mightily to get done. I'm assuming you have do you have a legislative breakfast, or do you have legislators to come over?
We have Breakfast of Champions, and we have it every year. And this was our second year of bringing legislators together to talk about it. And I know you were there.
That's right.
And it's so important to bring everyone together and to have everyone buy into, we've got got to figure out the resources for this because it cannot go under-resourced. We'll have more people in the jail system, and there's so many of those cases that can be prevented. We have people going to jail to dry out, to you know, and that's their detox facility, which is not how it should happen. No. And the cost of detoxing in your facility is much more than the cost of detoxing in mine.
$50,000.
Yeah, we're nowhere near that cost. And that's not the way to get people the help that they need and to make them more responsible citizens, able to give back to their communities. Some of the stories that resonate with me the most are when I hear of clients that have come out of our detox, gone into one of our halfway houses, gotten a job, become fathers again, become husbands or partners again to their family, their family members. Those are the stories that I think are less told and need to be out and more visible so people can see this is an example of success, not just let's just push them off and relegate them to, you know, the jail system. It doesn't work, and you know that better
Well, you know, it's funny you should say that because that's the word I was going to use. We call them success stories, and we actually invite former ex-offenders back to talk to the folks that are presently incarcerated, just to say that, you know, I overcame this, you can too. And it's interesting that you referenced Mayor Walsh. Right after he became mayor, we invited him over to tour the facility, and he wanted to go to our detox, our recovery unit. And we took him there, and there's probably maybe 20 or 25 guys. And as everyone knows, he's from the recovery community. And when he walked in there, clearly you could hear a pin drop, but it was like the Pope walked in. I mean, these guys were just transfixed. They hung on every word that he said. And what he said was, the thing that he said that really impacted me was, he said 18 years ago is when he was in the recovery community. 18 years later, he's the mayor of a major metropolitan city. He said, what he said to the guys was, said, look, that could be your future, that might not necessarily be your future, but if you stay on the path of recovery, you can achieve so many things, you know. But and he also he didn't make any pretense about how hard it is to stay on the track. You know, you fall off, you relapse, but you got to get back up, dust yourself off, and get back in the race. And he says, if you can do that, you know, some pretty good things. So when you talk about going back home and being moms or dads, you know, to their families and their family units. And the thing that really bothers us, well, a lot of it bothers us, but when you look at our female population, a lot of the ladies don't want to have visitation. They don't want their kids to come to jail to see mom in a jumpsuit, you know.
That's tough.
It really is tough. You know.
We get a lot of women who have been incarcerated in our halfway houses, and we do family reunification. So we'll do supervised visits, and we'll make sure that it will help them to get the rights to their children back again. And that's such an important piece of it as well, to provide a space where children can come and see their mother, because they may not have wanted to see them when they're with you, but with us, it's a home environment. It's a place where kids are welcome. We have toys, we have a space for kids to be able to come in and enjoy time with their parents. And I think that's just such an important piece of who we are and what we do. And those are the stories that drive me every day when faced with challenges of, you know, staffing challenges, all the like, those stories.
What makes me get up in the morning to go back and do this again, right?
Right. You know, people say, why are you here? You know, you went to Hopkins, you went to Brown. I'm here because this is what makes a difference. And I see the changes that we're making in the system, and that is palpable. When you come on our campus and you see, you know, the little children in the Head Start program learning, and you see the parents volunteering in that program, it's just such an incredible feeling, and it really drives me to keep doing more.
So, you know, I often say that the hallmark of any vibrant community or society is how that community takes care of and tends to the most compromised in that society, whether it's folks that have addiction problems, mental health problems, our kids, our seniors, folks from other lands, you know, how that community rallies around the most compromised really is, I think, significant. And then I follow that by saying I think it's incumbent upon us to help. I think we have to, you know. I mean, if in fact we really do ascribe to that, you know, helping your fellow man and woman and child, you know, and if you don't, then look, I mean, you know, you go through the day and you do what you do, but if we really care about a vibrant community, I think we have to do that. Now, talk to us about, you're in the middle of, or about to start a capital campaign?
We are in the middle of a capital campaign.
Okay, talk to us about that.
Our capital campaign is for our detox building. It was the old maternity ward when Dimock was a hospital, and it's a beautiful building that has basically fallen into disrepair over all the years that it's been in existence. And what we intend to do is to raise $15 million to do a full gut renovation of the building and provide more access.
Okay.
So we've met with a number of other recovery centers. We've had our staff participate in the design of the unit. And it's a unit that is designed to really infuse and integrate behavioral health into our detox unit. So you're not just there for substance abuse, but we're also treating your mental health issues.
Nice.
Have case management embedded in the unit, so it can really,
Nice.
case managers can plan out the next phase for our clients who are graduating from the program there. So it's a fully innovative, integrated unit, and the goal is to get the $15 million in by December of this year. So it is an incredible challenge.
By December of this year?
Oh yes, it's, you know, when I say that, people look at me like I'm crazy, and perhaps
like
I am.
I'm looking at you, right?
I may be, but that's okay. You have to be, you know, in many ways to do this kind of work, but it's with a purpose, right?
Yeah.
So it's the most, probably one of the most purposeful things that I've ever done is to really go out and talk about how people need to step up and, you know, go to our academic partners, our corporate partners, and say this is an issue that you may say it may not affect you in your daily work, but it does. It's in your family. It's in a family that you know of. Someone has been affected by either mental health or substance abuse. And in order for us to create solutions, we need to expand access to treatment, treatment that has all the steps laid out for clients to be able to take advantage of. And part of what we'll do is expand. We currently see 3,000 clients a year there. The goal is to open up into 4,000 clients a year by adding 10 additional
And how are they
beds.
referred?
They're any way, shape, or form. People come to us off the street. They're brought in by their parents. They're referred from emergency rooms, from jails, any number of ways. We are there to provide help, whether or not they have the ability to pay. So the goal is to renovate the center, to take advantage of new market tax credits, state historic tax credits. I will say Governor Patrick was incredible in that he really helped us to really move the needle on getting legislative support for our detox unit. So we're moving. We're definitely going to get there by December. It will be announced at our big event in November, Stepping Out. But our goal is to get everything in place and to make this happen because we have to.
Well, you know, it's funny because people will take as much time as you give them, right? And so if you've got a ceiling of December, you know, then hopefully you make it. If you don't, it won't be much longer after that. Is Flash still on the board?
The Flash is our board chair.
Flash Wiley, we're looking at you, brother. Come on now, Flash. Get busy.
He has stepped up,
Get
I will
busy,
say.
Flash. Oh, no, Flash is the man.
Oh, yeah, he is.
Oh, no,
He's
Flash
incredible.
Is the man.
He's
right.
incredible. And he, the board in particular,
You
has
do have a
stepped
great
up.
board. That's
I
right.
have a fantastic board. I'm so fortunate. They've stepped up 100% giving. In addition to what they typically give for the annual appeal and for Stepping Out, they've all stepped up to say they are fully behind us for this effort. And again, I've had really fantastic support from Mayor Walsh, from Governor Baker. I anticipate even more support, but we're going to make it happen.
We've only got a couple of minutes left. I want to do two things real quick.
Yes.
Talk to us about Stepping Out. When is, do you have a date set for that?
It's the first Saturday in November, November 7th. It's at the Sheraton Boston Hotel. We haven't announced the talent yet that's coming, but Stepping Out is one of the ways in which we bring in unrestricted dollars. So it's an incredibly important event for us. It's in its 28th year. It's been going on for a long time. But it's a great way for us to function as a convener. We have people from all different walks of life coming together in celebration of Dimock and the work that we do. So we're really excited about doing it again this year, and we know that it's going to be a fantastic event like it was the last few years.
Like it is every year for the last 27, 28 years.
That's right.
And unrestricted dollars means that the money that comes in from that can be utilized for anything.
That's right. So it can be used for operational support. It can be used to support positions that don't generate revenue, like case managers that are critical to our model. So it's one of the most important events that we do. And then very quickly, we are launching a new event this year. We're hopeful that we will get you out for this too. It's a walk-run. It'll be in September. We're working with...
I'll be doing the walking part.
the mayor said he's walking. He's not running, but we'll see what can happen.
Right.
But it's going to begin and end at Dimock. It'll be a 5K run, a 3K walk, and then a kids fun run. We're working with Hood Fit. Thaddeus Miles from Hood Fit,
he's a great guy.
Been fantastic, and the Boston Athletic Association is supporting us as well. They are coming together in partnership with us to create a sustainable event focused on health and wellness in Roxbury.
Do you have a date for that?
We have a tentative date of September 12th, and we'll be solidifying that in the next few weeks. But it'll be out and about, but we'll get you out there.
I'll be out there.
Get your
Listen,
sneakers on.
you know, I'm a big fan of Dimock. And finally, if folks want more information about the center,
www.dimock.org.
Okay.
And for Stepping Out is www.steppingoutfordimock.org.
Oh, great. Thank you so much for coming on.
Thank you for
really
having me.
Appreciate
It's been
it.
fantastic.
We'll keep our eye on you, and whatever we can do to help. Just give us a buzz. We'll be there.
I certainly will let you know.
Okay. All right, folks. We're going to go to a break, and on the other side, we're going to return with State Senator Anthony Petrocelli. So please do stay tuned. you.